Today we have Dr. Melissa Lem, a Vancouver family physician, physician who also works in rural and northern communities within Canada. She's the Director of PaRx, Canada's first national nature prescription program, and President-Elect of the Canadian Association of Physicians for the Environment. And actually, for those of you in Toronto, you may have seen that we have a climate action mural on the front of the CSI Spadina building, put there by the School for Climate and created by the artist Jessica Gorlicki. And they will be adding the words planetary health equals personal health tomorrow, actually inspired by the words and work of Dr. Lem. And hosting this conversation, we have my colleague Shay Sinnott. Shay's our Senior Programs Manager of Climate Ventures. She comes from a background of community education and organizing with a focus on environmental campaigning. She's worked or volunteered with various organizations such as the David Suzuki Foundation, Open Media, and Lead Now. I'll be keeping my eyes on the chat and Q&A, and for now, I'll pass it to you, Shay.
Thank you, Barnaby, for that lovely introduction. Let me know if you can still see my screen. You shouldn't be able to.
Yep.
Hi, Melissa, how are you?
Good morning, Shay. I'm doing well. How are you?
I'm well, thank you. So I'm also in Toronto. I want to acknowledge that I'm also in Toronto or Toronto on Dish with One Spoon territory. And where are you joining us from?
I'm joining from the traditional, unceded, and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh Nation here in Vancouver. And I have to say that as I'm looking out my window at the cherry blossoms that are just starting to pop on my street, and I walk by the ocean every day in the middle of a pandemic, having so much healthy green space around me, I really am grateful to the stewardship and care that Indigenous peoples have exercised, over these lands since time immemorial, and I'm just grateful for what they're doing for us today. So yeah, I'm grateful to be joining from here, and thanks for having me.
Likewise, I got a nice little glimpse of the lake on my way here to our downtown Toronto CSI Spadina location, and the magnolias are blooming here, and yeah, it's gorgeous. Also want to acknowledge tough times, so sending love to everybody that's tuned in, and thank you for being here. So as we'll talk about today, nature and spending time outside, we've already started talking about it, is really important for you. So I was wondering if you could start by telling us a little bit about natural places or experiences outside that you've been, that have been kind of formative or important for you, just to start on a personal note.
I think there are so many, and this is something that I think a lot of people who are active in the climate and environmentalism movement have in common. Not everyone, but a lot of them. So I grew up in Toronto. I grew up in the suburbs of Toronto, in East Toronto. And really the first time that I felt like the first time I really did see the stars was when my family went camping when I was 7 or 8 years old. I have 4 siblings. There are 5 of us kids. So we all kind of piled into our station wagon, and went to Bruce Peninsula National Park. And I just remember, which I love. It's one of my favorite parks in Canada. And I remember our first night with our tent set up. We were new, I was a new camper. I'd never done it before, although my parents had. And looking up and seeing thousands of stars I'd never seen before, because of the urban glow, and having the campfire in front of us, looking up at the trees, and all I could hear was campfire and trees instead of traffic. Like, we actually lived at the middle of a street where at the top there was a fairly major freeway going by. So just that experience of feeling connected, feeling like I was small, but also part of something greater. I think that was really the start of my love for nature. And so that really followed me all the way through life, I would say, in many ways. So I did a speech on saving the rainforest when I was in public school and said it in front of my whole school. When I was in high school, I actually, my science fair project that I chose to do in grade 12 was actually examining the effects of air pollution on new plants, and quantifying how much damage was done to the little leaves to figure out how much air pollution there was. And yeah, I've just tried to connect to nature through my career as a physician as well the entire time, on an intuitive level, kind of understanding that's what I needed to de-stress. And I would say kind of the turning point for me when I realized how important nature was for people's health was a personal experience. So my first job out of residency was as a full service rural physician up in Northwest BC on Gitxsan and Wet'suwet'en territory called Hazelton. And so I loved it. Like I lived in a house on the hospital grounds. My commute to work involved a 6-minute walk where I would look at snow caps, you know, and see the mist from the river and walk by bushes, like what raspberry bushes where I would pick wild raspberries. Like it was amazing. Bears walking across my driveway, the whole works. And then due to family reasons, I moved back to Toronto actually after 1 or 2 years of working there and moved essentially to Yonge and St. Clair, which is close to downtown. And so I remember one time kind of sitting in my apartment at the time and kind of looking out the window and looking at the sky and seeing this tiny little square where I could see the CN Tower and a little bit of green space underneath it, and hearing the streetcars rumble by and thinking, why am I so stressed? Like my work is way easier. You know, I'm not dealing with heart attacks or trauma anymore. I'm not, you know, having to deal with acute inpatients who I have to transfer because they're either really sick or crashing. I'm doing outpatient medicine, which is arguably much easier. And so as I heard the noise of the streetcars, saw the tiny bit of sky, I thought, you know what, I think what I'm missing is nature in my life. Like every day when I went to and from school, I had that experience of being able to de-stress, and I had nature everywhere. And so I thought, okay, well, this is something I'm feeling right now. Like, is there evidence to back it up? Like what every kind of person trained in biology or physician does is they want evidence, right? Otherwise it can't be true. What we feel can't be true. And so I started doing a lit review on the health benefits of nature. And this was just over 10 years ago. And I found this incredibly huge body of knowledge around the evidence behind the health benefits of nature that I wasn't aware of. Like even being someone who loved nature, who my, you know, family teased and called me a tree hugger when I was little, I had no idea. This was not something I learned in school. And so I thought, wow, like look at all these health benefits. I was not aware of this, even though I'm kind of active and interested in this area. My mission now is going to be to educate my colleagues and the public about the health benefits of nature. And so, yeah, this was about a decade ago. Before that had really hit the forefront, before people were really interested in it. And so everything just kind of rolled forward from there. That's a long-winded answer to your question.
That was wonderful. What a great setup. Yeah, no, personal. And then we also heard some of your story. And I love that you moved around a lot. Hopefully people can connect with a lot of the places that you named. So thank you for that. So I wanted to dive into what you just started speaking about. So you're the director of PaRx. Let me know if I'm not pronouncing that right. An initiative of the BC PaRx Foundation. And so as I understand it, the initiative's aim is to make prescribing nature simple and effective, easy really for kind of patients and physicians alike. And it's based on this premise, as you noted, that connecting to nature is one of the best things you can do for your health, which we all kind of know intuitively, but now is being backed up by this kind of mounting body of research. So how does PaRx work, and why is it significant? Like really, like why create a prescription for nature? What's the purpose of that?
Yeah, so you asked me to tell you if you're pronouncing it correctly, and you kind of, like a lot of people pronounce it that way, but I think right now we're calling it PaRx because it's kind of like an
oh gosh, I'm sorry. Barnaby asked me how to pronounce it, so I told him wrong.
Yeah, I think it's just so we don't confuse the word PaRx with the logo or whatever PaRx. We're calling it PaRx. But yeah, so I mean, as you mentioned, this is Canada's first national evidence-based nature prescription program, and we're following along with following in the footsteps of colleagues in the US and also in the UK who have kind of put a lot of money and investment into national nature prescription programs. And we're Canada's first, which I'm really proud of. So basically, what we did was we rolled out in BC in November 2020, and then we rolled out in Ontario in February 2020. So now physicians in both provinces can prescribe nature. And one of the major reasons we did this again was to kind of promote this idea that nature is good for us in an evidence-based way. And the reason why we wanted to kind of formalize it was because the evidence shows that writing something down, like actually formally prescribing something, increases the chances that the patient will be motivated to make that change. And so we take a lot of this this evidence from the exercise prescription literature that shows that writing things down and formalizing it and reducing barriers increases the chances that people will do something. So that's a major reason why we wanted to do that. And also it's just to kind of give colleagues, like, so any health professional, any licensed health professional can prescribe nature through our program. And we want to make it really easy for them because we know there are a lot of barriers to adopting new behaviors among health professionals: time, billing, knowledge, all kinds of things, just ease of doing it. And so we have some really kind of interesting and easy, attention grabbing and easy to review fact sheets that are broken down by health issue that you can actually download or print and hand to your patient to kind of underline the health benefits of nature for their specific condition. And then we also have really easy prescribing tips for prescribers, kind of our top tips for making their nature prescription more effective, and also tips for patients and kind of engaging ways to show them how good nature is for various parts of their health. So yeah, we just wanted to make it really easy and also follow the evidence in making it as effective as possible.
So with formalizing it, increasing the chances, sounds awesome. And then I know something that we've talked about is also that it increases the likelihood then of people protecting the places that they love too. Can you say a little bit more about that?
Right. So there's a pretty good body of evidence also showing that people who are more connected to nature are more likely to protect it. So there's a study showing that kids who are more connected to nature when they're young and their formative experiences are more likely to become environmentalists. So I don't know about your childhood, Shay, you know, if you spend a lot of time in nature, is that something that you did when you were younger?
Yeah. I grew up on the West Coast and I spent a lot of time on the beach.
Right. Yeah. And that's sort of something that solidifies that connection to nature and makes you want to protect it. So it's very intuitive, but research bears it out. And there's also evidence showing that adults who are more connected to nature are more likely to engage in pro-environmental behaviors. So we're not just talking about conservation, but we're also talking about advocating to politicians. We're also talking about saving energy, recycling. So they're more likely to do like a wide suite of environmental behaviors, pro-environmental behaviors, if they're connected to nature. So by prescribing nature to people, I would argue that, you know, every prescription you write, every time you get someone closer to a meaningful nature connection, that you're also doing something for the planet, because we're creating this body of people who are both nature connected, so healthier, but also more motivated to save the planet, which is what our overarching goal is right now. So anyway, I think it's a great initiative on a number of fronts from both human and planetary health.
No, that's great. And then also you hinted at it too, that also the healthcare workers and the physicians and nurse practitioners or nurses, whoever is doing the prescribing, are also those that are involved in that alternative form of advocacy, which is really cool. Though, as I've read about, as we've talked about a little bit, many argue, and we've seen this in the last year or two, that there's been this surge in interest and, you know, parks are being overwhelmed. We're all really appreciating time spent outside and connecting more to the places that we live in, which is fantastic. And yet many voices are noting like, well, access to nature is not open to everyone equally, and it's not neutral. And so by that, I mean, there are structural barriers. So for example, on the one hand, you know, fees to access parks, or, you know, affordable transportation. Like, do you need to own a car in order to access a park, say in Southern Ontario? That's like in some ways true. As well as stereotypes about who belongs. So, you know, people like me in mech commercials, lots of voices saying like people of color, new immigrants, people with disabilities don't feel included in that narrative around who's connected to the outdoors. And then some of us may be listening that live in cities. So it's harder to get to stuff. Or what does it even mean? What do we mean by nature? So as a long preamble, but how can nature and experiencing nature be more inclusive, do you think? What steps can we take to address those barriers that I noted?
Right. You touched on so much there. So I'm going to try to remember
Sorry.
with every single, you know, thing that you mentioned. But I think the first thing that you brought up about different types of people who don't see themselves reflected in you know, mech ads, being connected to nature. So, I mean, one thing that we're really trying to do with the BC Parks Foundation is connect groups of people to nature who wouldn't otherwise necessarily have that experience. So something that we did, for example, pre-pandemic was liaise with Mosaic BC, which is kind of like a new Canadian resettlement agency, to bring groups of people out into nature who hadn't before. So this included new Canadians like refugees. This included elders. Like we brought a whole group of elder Chinese immigrants actually out to Mount Seymour on Lunar New Year. This was about 2 years ago. And for many,
cool.
that was the first time they'd been up on the mountain, and it was snowing and they had poles. And actually not all of them had appropriate footwear, clothing, but they were so happy to be out and to be out as a group and experiencing this for the first time together. So I think if we partner, if organizations partner with groups that really focus on people who don't normally see themselves out in nature, like new Canadians or refugees or elders, that can make a difference. So that's a big focus. Other foci we have are, for example, on at-risk youth. So we've partnered with Foundry BC, which helps with youth who are having mental health issues and addictions. And so there are just so many opportunities I think that we have, and we really have to direct our attention, I think, more towards those groups of people who aren't already part of the choir, who aren't already getting outside every day up on mountains out in the backcountry. So I think that's really important. And then I think people also need to see more people like themselves out in nature, So, I mean, for example, I grew up in Toronto. I grew up in a majority white neighborhood, actually, and have to say that I did experience racism growing up that made me feel like other and made me feel like I wasn't necessarily accepted in the space that I grew up in. Like, it wasn't anything major, I would say, but it really does shape you, I think, when you don't feel like you really belong in your own community, like teasing on the schoolyard or even kids calling things out, as I was walking to school. So what I found personally was that I went into those natural spaces when we went camping for the first time, when I was in, the park that was down the street. I felt safe. I felt like, the trees weren't judging me. The trees weren't going to tease me. Like the brook babbling by was talking to me in a language, that I understood, and that wasn't making me feel uncomfortable about being in my own community. So I think that's also part of connecting people to nature, is helping them to see, that it's a safe space, and helping realize the safety of those spaces, and making them see that it's a place where you won't be judged. It's a place where you can be safe and you can be yourself. So anyway, and I think just giving people that experience, it goes a long way towards that, for them to see the stars for the first time, or for them to see the tall trees or the mountain for the first time, in a group of people that are supportive and being inclusive. I think that's really important. And then I think you also mentioned barriers. So barriers to nature access. And that's something that we're really thinking about with our nature prescription programs. So we take, again, a lot of the social prescribing movement informs a lot of what we try to do. So you're right, like these big, beautiful national parks, a lot of the really beautiful nature, you need a vehicle, like you need a private vehicle or some kind of, chartered bus or whatever to get to it. And so I think something else that we're working on is trying to, for example, expand public transit, to, or perhaps even sort of make public transit discounted or free for people who want to travel to these parks. And then, just again, partnering with different parks organizations to provide free passes or admission to people who really need it. So those are all projects that we're working on. I would say, and I'm not sure if there are more aspects to the question.
No, that was great. That was like a triple barrel question. So
I know. I'm trying to remember, it's early-ish in the morning here.
No, that's great. Thank you very much. So much to talk about. I really loved the notes about partnering up and working with others. And I think that it's so great to speak to people like you who, in your career, in your work, in your life, you embody like so many different, what some might see as single issues. And it's all about connecting the dots. And so not thinking about social versus environmental, but seeing, in your case, the connection between human health and planetary health. If we better human health, we're also protecting the planet, or vice versa. So on that note, shifting to a kind of more recent step in your career, it would seem, I know you are a doctor in addition to many other things, and that you're a vocal advocate for climate action, that you are a director, you're on the board with CAPE. So that stands for the Canadian Association of Physicians for the Environment. And as I understand it, it's a national organization that works at that sort of intersection of human and planetary health. What prompted you to take more direct action? Like, what prompted you to get involved with CAPE? Let's start there.
To be completely honest, I was kind of avoiding climate change for a while. So I was aware of it, like I knew the effects were happening and they were present and we needed to take action on it. But it really wasn't until I had a child that I realized I had to take action. So I remember exactly the moment. And it's funny, I actually have a photo of this moment. So we were living in Toronto. It was early 2015, shortly after my son was born. He was 3 months old, and my husband was teaching in Montreal at the time. And I had him on my lap. I was nursing him, and I was reading Naomi Klein's "This Changes Everything," which is a book about climate change and capitalism.
Chill reading.
Yeah, I know,
It's about that thick.
Nursing a child. I've got like this. It was actually on a little like e-reader, so it wasn't huge. It was actually like a little. Anyway.
Okay.
Type thing. And I was reading it and reading what she was saying about how we can't ignore this anymore, about how the very systems that we live in are contributing to the climate crisis. And looking at my son, my 3-month-old, on my lap and thinking, I can't ignore this anymore. Like, I've worked in the nature and health movement for a while now, and I really need to start directing my energy towards climate change, because that's what we need to do to basically save our planet. So it was at that moment I thought, like, it's funny because I knew some of the major players in CAPE and they've been encouraging me to get involved, but I was sort of holding back because I thought, like, this nature and health thing is my thing. Like, I don't know if CAPE is my thing, but then I realized, what CAPE is my thing? CAPE has to be all of our things, as health professionals. So, yeah, I started to get more involved. I became a board member in 2018, and I've just helped work on many of their initiatives since then. So yeah, but it was honestly, it was having a child and forcing myself, to pay attention to what was going on in front of me that really led to my movement into the climate sphere.
Thanks for that. And on that last point too, you were saying, second to last point, the work being done at this intersection. Can you say more on, what you've done so far with CAPE, or what's your focus? Like, again, this intersection between human and planetary health, because I think I'm still wrapping my head around, like, what does that look like? So can you comment more about that work?
Yeah, I think it's really important for us to, especially in the health profession, to frame the work that we do on climate change as having co-benefits for humans. So the research also tells us that it's not images of polar bears or forests or coral reefs that motivates most humans to make a change. Like, humans are great. I love humans, but many of us, understandably so, care about ourselves. We care about what, our own egos, our own, what we're accumulating. But health is something in common that we all have, right? So when you use messaging that has to do with health effects, like, for example, the World Health Organization has said that climate change is the greatest risk to human health of the 21st century. When we start framing climate change as having effects on our health, I think that's what's going to motivate people to move. And I think as health professionals being trusted, I mean, there are these surveys that happen in different countries around the world, Canada included, that ask who are the most trusted professionals, who are the most trusted people in society. Nurses, doctors consistently come out on top. Nurses above us, I would like to add. So anyway, I think if we mobilize all health professionals, like the health profession, to start communicating that message that taking action on climate change is healthy for us and will result in better outcomes, better health, prosperity for our kids, for ourselves, I think that's what might motivate people. So that's what we are really trying to do at CAPE, is trying to get that message across, that a healthy planet equals healthy people.
Amazing. And what a moment, given this year, and again, these two kind of intersecting crises of COVID-19 and then the climate crisis. Yeah, like, what do I want to ask? I mean, so I know CAPE advocates for a healthy recovery to COVID-19. Can you comment on that? Like, what does a healthy recovery look like? What are some key calls to action? And if you could connect the dots a little bit for us around COVID-19 and the climate crisis, that would be helpful.
Sure. So in a healthy recovery from COVID-19, it sounds complex. It's like, there's so much we need to do, but really it's pretty simple. And I think it's that we need to invest in areas that improve the health of both people and the planet at the same time, because not only is it one of the greatest health threats, but it's tackling climate change is also one of the greatest opportunities we have to improve people's health. And we know COVID-19, it's thought to be a zoonotic virus that emerged at the interface of humans and animals, and arguably because we haven't been respecting the natural environment enough. So by tackling things that mean that we are respecting the natural environment, like preserving our natural ecosystems, for example, giving those animals their space, you know, to live their lives in ways that don't spill over into humans, I think is really important. So, I mean, Kate, for example, we released our Healthy Recovery Report in June of 2020, and what we showed in it was that if Canada meets its climate targets, that will save over 100,000 lives between 2030 and 2050 due to air quality improvements alone. So this doesn't address just the cardiovascular benefits from more active transport or just, you know, other direct human health benefits. It's just from air pollution. And by doing this, we also projected that we'll create 1.3 million good, clean jobs, sustainable jobs by 2050. So in the report, I won't go through the whole thing. It's long. I was a co-author, but basically we need to create investments and regulatory changes that decarbonize our electricity generation, our public transit, our vehicles, our buildings, and our healthcare. And we also need to invest in protecting and connecting to nature. And we can do this in times of crisis, like we've done it before. So example, with our neighbors to the south, in the US during the Great Depression, in the 1930s, President Franklin Roosevelt created a massive series of reforms called the New Deal that, for example, provided financial relief to help the 1/3 of the population that was hardest hit by the Great Depression. And one of their major projects was to hire them and others to create a series of national parks, which is kind of what, you know, what served the basis of these amazing national parks that the US has right now. And they also worked on much needed public infrastructure like schools and sewers and streets. We saw this in Canada as well. Like we saw mass mobilization during World War II. The entire populace, the entire economy was oriented towards this war effort. And so many would argue, like in Seth Klein's book, A Good War, that we require the same commitment and the same mobilization now. So I guess the thing is, like, now we have a roadmap, you know, we know the things that we need to do. And the question is, how do we keep ourselves accountable and how do we make it happen? And I think that's where CAPE's latest initiative, which is a Healthy Recovery sign-on letter for Earth Day, comes in. So since we released the Healthy Recovery Report in June 2020, we've learned a few things. So one is that our carbon emissions are not going down despite commitments. So Environment and Climate Change Canada reported that Canada's greenhouse gas emissions increased again in 2018 and 2019 and were largely unchanged since the year 2000. And meanwhile, other neighbors, similar neighbors like the UK, for example, dropped their GHGs by 38%, and 35%, and the US dropped theirs by 8%. So it's happening elsewhere. And we also discovered via Health Canada's recent report that over 15,000 Canadians died of air pollution in 2016. And there was a recent Harvard study that showed that 1/5 of premature deaths around the world are from fossil fuel related air pollution. So if we think about the deaths that are happening from COVID-19 and the massive changes that we've made as a society and have gotten behind, like 1/5 of people in the world are dying from air pollution as caused by fossil fuels. So it's like, why are we not treating this with the same urgency as we are COVID-19? Despite all these things, right, Canada has actually subsidized the fossil fuel industry to the tune of over $20 billion since the beginning of the pandemic. And so we need to take action now, otherwise we're going to see global heating within our kids' lifetimes that will be catastrophic for health. So we have some key asks in advance of President Biden's Earth Day summit that's happening in 2 days. We have these asks for Prime Minister Trudeau. So we need these big, bold commitments to reduce our emissions. We, to do our fair share based on what we've emitted so far and what we can do. We're suggesting that we need to cut them by, many people are suggesting we need to cut our GHGs by 50 to 60% by 2030, not the 30 or 36%, that's been mentioned before. We have to strengthen our accountability. We have to strengthen BC12 by making its first milestone year in 2025, not 2030. We need an independent body of scientific experts who report to Parliament independently, not the Minister of the Environment, so they can create their own climate modeling and also tell us what's happening in real time so we can act on it. We have to phase out or eliminate fossil fuel subsidies. Like, imagine what we could have done or what we could do in the future if we directed that $20 billion to transitioning oil and gas workers to a clean energy economy. I mean, given what we know about the risks of air pollution, the health risks, subsidizing fossil fuels is as unacceptable as subsidizing tobacco. So we have to be accountable. We have to think about racialized and Indigenous peoples across this country who are suffering the most from the impacts of our resource extraction industry, and then also create strategies to move forward so all Canadians, so every Canadian can move forward in a healthy way.
Thank you for that. So many facts.
I know,
Gold
there's so much.
stars. No,
So much
it's fantastic. No, I'm learning so much. Gold stars to whoever can find the link to the Healthy Recovery, and it's a call to actions petition. And pop it in the chat so that people can, and we'll send it out afterwards too. And hopefully a link to the report has already been shared. So I know you noted the summit coming up in 2 days with our neighbors, and so Trudeau and Biden getting together, and that we expect that there will be more announcements or more details coming then. And yet we just saw a federal budget released yesterday, and so hot off the presses, it's a bit early for analysis. I think it's like 700 pages or something like that. But from what I've learned pretty quickly, and from a climate perspective, there seems to be a focus on cleaning up big industry and incentivizing businesses to go green. But then it's already kind of being criticized for like it's light on new investment, especially in the case of like energy retrofitting and green building and that sort of thing. What I did notice was that there's 4.1 billion, I believe, set aside for conservation and protection. And so this is, I believe, parks, urban green spaces, protection of wild species, that sort of thing. Sorry, I'm just going through the list, but seems like there's a lot that's relevant for this conversation, and yet no increases in healthcare transfers to provinces. What's your take, given you kind of touch on so many different elements, I guess?
I think, as someone who is really focused on nature and health, I applaud, the focus on expanding and protecting green spaces. And also in the throne speech, what they said about protecting 25% of our natural spaces by 2025 and 30% by 2030. I love that part. But I think the targets that they brought up in the budget, which apparently, from what I hear, there will be new targets announced, during Biden's summit of 36% reduction in greenhouse gases by 2030. It's nowhere near what we need to do and what we're responsible for doing in Canada to move us where we need to be in the climate emergency. So I'm hopeful, that more will come out in the next 2 days. That will reflect more what we need to do. And there are some good things in the budget. Like I really appreciate the focus on providing $10 a day daycare, within the next little while, because empowering women to work, empowering people to know that their children are in a safe place so they can take action on things that matter, I think is really important. But yeah, there's room to go. And it confuses me a little bit as to why we have these sort of targets announced on this end, whereas the new ones coming in 2 days, it's odd. So yeah, it makes me wonder what they're up to, but I'm hopeful, that more ambitious targets will be announced in a couple of days.
Totally. We're going to shift to questions from the audience soon. So if you haven't already, people tuning in, I know there's lots of conversation going on in the chat. Please add your questions to the Q&A function. That will make it easy for Barnaby to curate. So you'll see that at the bottom of your screen, rather than using the chat, and then we can see them all there. You can also upvote each other's questions too. So we know that we can check out PaRx, BC PaRx Foundation. We know that we can check out CAPE as well, and then sign that petition for a healthy recovery. What else? How can we support your work? How can we support you in your work? And is there anything else that we can do, or is there anything else that you'd like us to kind of pay attention to right now, given your work?
Yeah. Do you know what's funny is just by doing something on your own that moves us one step away from greenhouse gas emissions, by getting outside on your own, that's one thing that you can do, is doing something today, because I think there are a lot of barriers to people taking action. And I totally understand that. Like, I'm a family doctor. I speak with people every day who have barriers from time to energy to physical or mental illness that's preventing them from making major changes. But just thinking about what your skills are, like what your unique values, what your unique value proposition is, like what do you do really well, and how can you kind of pivot and use those skills in service of your community and climate, I think is really important. So you could be an awesome baker, you could run a bake sale to raise money and donate to a climate initiative. You could, if you write well, you could write to your MP or write an op-ed in your local paper. If you're really good at just talking to people, you can, like this, Shay, you can host a Zoom with your friends and bring people together and just talk to them about it. There's so many different ways that people can support the work that I'm doing, which is part of the work that so many other people are doing, and to move us towards a healthier future, right? But in terms of specifically, I guess what you could do to help what I'm doing, if you're a health professional, like a licensed health professional, you could sign up to prescribe nature. And I think we talked about the benefits to humans and the benefits to the planet of doing so. So it's open to any licensed health professional, from nurses to physiotherapists to OTs to psychologists to registered clinical counselors. So I would encourage you to sign up to prescribe and then just tell people about our program. In terms of CAPE, again, if you're a health professional, sign on to our Healthy Earth Day, Healthy Recovery letter, and then get involved. Like, we actually have several chapters across the country. Because again, it's like, well, if I join CAPE, what do I do now? But we've really focused on building that structure within CAPE that allows us to meet people in our own regions and work together on projects that impact our own regions. So I think that's really useful. And that's really important, is finding your tribe, because this work can feel lonely sometimes. Like, the first thing I did when we moved to BC, actually from Toronto, was to find people I could work with on the environment, on nature, because it's difficult. You can't do it on your own, obviously. We don't all have millions of, we're not like social influencers where like people are hanging on our every Instagram post. Like, we need a team, right? To get our message out there. So I think that's really important, is just connecting with like-minded people with CAPE. And money is the other thing too. So, nonprofits are not as well funded as these big corporations that often have the ear of government. So donating to, if you don't have time or you don't have the energy right now, like clicking and donating helps as well.
Awesome, thank you. And we'll be sure to share out lots of those links afterwards for folks that registered. I'm gonna shift to questions from the group, and we'll hear from Barnaby, and then I'll come back with one last one at the end.
Thanks, Shay. We've got a couple so far. One was from an anonymous person, but they work in early childhood education, and they were writing about kind of just the importance of those formative years in a child, or the early years of a childhood, and wondering if you've done work around prescribing nature to families, specifically for young children, and the role of nature in young children at that crucial development stage.
Right. Do you know what's interesting? We have 7 fact sheets dedicated to children, on our website. So we definitely have children in mind. And with the BC PaRx Foundation Healthy by Nature initiative, a lot of the work that they do is focused on children and families and connecting them to nature, whereas PaRx is for everyone, right, from adults to kids. So there is a pretty significant body of knowledge around childhood development and health outcomes and contact with nature. So we do, again, have a whole fact sheet on kind of prenatal health and also early childhood health. Like, for example, there's a study from kids in Denmark that looked at kids who played kind of in natural environments, like on the edge of a forest versus on a playground. And they found that the kids who actually played in the natural environment developed their motor skills faster, their balance faster than the kids who played on a traditional playground. So there are definitely a lot of kind of, there is research around early childhood outcomes, and head to our website and check them out.
Awesome. And then we've got another question by Nate Gerber. And so he's asking specifically around the kind of connection between mental health and the climate emergency. And he asks, given that the medical community may have some reticence and limitations in their ability to act politically on these issues, how has the discourse around climate and mental health evolved in the medical community? And related to that, might you have any thoughts on what medical professionals should consider or do in response to this emerging concern?
Yeah, and I think, again, this speaks to sometimes the loneliness of feeling like you're the only one speaking up. There is, I think, a pretty significant body of health professionals now in Canada, at least, who are speaking up and supporting each other. So I would encourage, I don't know if you're a health professional, the person who asked that question, but just, again, join like-minded people and you'll find support. And actually, the Canadian Medical Association, which is like the biggest kind of doctor body within Canada, our national body, has gotten on board with climate change. So for example, I think it was 2018 that they signed on to a call for action on climate change that CAPE created, that called for phasing out of investments of fossil fuels, that called for setting ambitious targets, that called for reducing greenhouse gas emissions and investing in areas that will improve the health of people on the planet at the same time. So it's actually not as fringe, as people might think. Like, I was just about to say something about my fellow physicians and, the fancy vacations on the SUVs and stuff. But anyway, I won't go into that very much. But yeah, I think part of it too is just being good role models, right? Like you want to, when you speak, you want to also be, you want to be walking the walk as well. So I think that may be a disconnect for some people, for example, who are higher income. Like they're like, well, I'm comfortable here. I'm not going to, like, climate change isn't going to affect me and my family as much because of all the resources we have. But I think, like, it's our duty, right? Like our mission is to improve people's health, and that involves people in our communities and in our country and the world at large. So I think it's part of our responsibility to do no harm, to make sure that we are working on issues that don't just affect our small little medical sphere, because climate change is coming and it will actually affect the delivery of healthcare services in the future, and is now even. So anyway, I would just say, get involved with people who can support you and look beyond, I guess, your own practice.
Thank you. And Andre is just curious about the sense of urgency amongst the healthcare community when it comes to climate change. Have you noticed any kind of change in the way that people kind of perceive this crisis and the connection to health?
I think it's shifting for sure. Like, I remember, I think it was about a couple of years ago again, when I was reading a report on appropriate messaging to do with climate change. And the messaging at the time was, don't call it the climate emergency, because people won't believe it, and people, it'll sort of turn people off because they won't view it as such. But I think when we see what's happening with record-breaking wildfire seasons on the West Coast, smoke blowing up from the south, from the US, with floods, with droughts, with heat waves that are killing people, with Lyme disease expanding, like, I think it's harder for people to ignore, and health professionals, because we're seeing the effects. We're seeing, like, I saw more people coming into my office with asthma exacerbations. I saw depression and mental health issues spike when the wildfires were happening on top of the pandemic. So anyway, I think it's becoming harder to ignore. And I think the health profession is definitely starting to pay more attention. Like, even just people who are talking about it, even just people who are interested in joining CAPE, like, 5 years ago, I would say that, in some ways, also including myself, like, there wasn't this huge mobilization of people who are interested in health professionals who are interested in taking action on climate change. But now so many people you talk to are interested and are aware it's affecting us now. So there has been a shift, I think, especially as we've seen these effects starting to affect our families and our patients.
Awesome, thank you. I have a question which is probably a bit of an odd question. I don't know if you've been asked this before, but the quick background is, a decade ago, I was living in the United States, and I worked on an article that looked at the benefits of virtual nature and the context in which that could be used. There was a small body of research at the time, but even just putting like a TV screen, a flat screen on the wall in a hospital where someone's recuperating and having nature, there was measurable benefits to that. And as part of that story, I interviewed people who were basically living in Second Life because they had, a challenge. They didn't have mobility, so they were stuck at home and they weren't able to go out and experience nature. So virtual reality was a way for them to do that. But the reason I ask is there's accessibility and equity. Toronto, for example, is a very hard city to get out of. And if you don't have a vehicle, I mean, getting to nature, real nature, where there's that kind of, the spontaneous magic, you don't know what kind of animal you're going to encounter, can be quite difficult. So I was just wondering if there's anything around, and of course we're competing with screens for basically everyone's attention. So wondering if there's been any work around virtual reality or virtual nature as a way for some people to get the benefits, and also perhaps as a way to encourage people to go experience the real thing if they can.
That's a great question. And yeah, as you know, there has been research around that. So there's been research looking at VR nature experiences, and then what they do actually is they'll insert different aspects of nature, like they'll play a sound, play bird song along with the images, or they'll just have the images, and they'll see like what has the most effect on people's health parameters that they measure. And so yes, there has been research on that, and some really cool research just that's come up recently looking at just the effects of hearing birdsong and hearing natural sounds on our health. So not just seeing them, but anyway, yeah. So nature, there's so many different aspects of nature that can improve our health. Like there's research showing that just having photos of beautiful nature on your walls, or again, just playing sounds or smelling nature actually can improve your natural killer cell amount and boost your immunoproteins. Like it doesn't have to be that deep nature. It's as many natural elements as we can get into our interior lives, I guess, or in our indoor buildings can also help. So one thing that we're starting to do with the BC PaRx Foundation is talk to some health partners about bringing nature indoors to, for example, inpatients who can't go outside because they're sick or isolated. So through the use of, for example, a tablet looking at nature while a nature therapy guide takes them through sequences to connect them, or through virtual reality. We actually are exploring that because we realize there are barriers, especially right now, to people accessing nature. Like here in BC, they just put in an order kind of preventing people from moving outside of their health authority, and there are some health authorities where there isn't that much nature around. So yeah, I think, and then one other thing I think we have to do is change our concept of what nature is. And I think I just kind of alluded to that, but some of the studies that have come out, they don't ask people like, how many hours did you spend deep in the backwoods of a national park and what are your health outcomes? They asked, have a meaningful nature experience to you for at least 10 minutes, 3 times a week, and see what the outcomes are. And people could define that nature experience in any way they wanted. It could be on a bench in Queen's Park. It could be in their garden. I think we have to move, especially in the city, because we don't have as much access to these majestic nature, I guess you could say. But we have to redefine nature as what we can find in our environments and look for it where we can and try to connect. And I think we can see some of those meaningful and powerful health benefits just by connecting to the green, what green we have in our own environments.
Thank you. I'm building off of a question that Bianca is asking, and it's kind of just the intersection of COVID-19, the pandemic, and what it could mean for climate action. So specifically, they ask, other than sharing alarming, impactful statistics with people, how can we encourage and promote governmental bodies as well as individuals to treat climate change with the same sense of urgency and action as we've seen with COVID? So wondering if you've seen a shift through COVID or an opportunity forming in getting people who may have not been paying attention before to pay attention.
Do you know what I think the big opportunity here is people realizing how important health is? Like we can kind of take health for granted sometimes, but we can't anymore. Like the pandemic is in our faces. This zoonotic virus that again emerged because we didn't respect nature enough and then spread around the world because of air travel, which also releases greenhouse gases, which are harming our climate. Like that's why we're in the situation we are today. So it's impossible to ignore health right now. And I think doctors, nurses are in the media so much right now. Like they have more than ever have become such trusted spokespeople and are informing us of the urgency of what's happening right now with COVID-19. So I think it's so easy to make that pivot, like, from us communicating about the harms and the risks of COVID-19 to the harms and the risk of climate change. Now that health is in the forefront, I think that's a big opportunity. And then I think also what we've seen, like in the early stages of the pandemic, when air pollution dropped across the planet, right? Like people could see in the distance where all they saw was haze before. Like I think people realized also that like things that we do are harming our ability to be healthy, and we can actually make changes. Like no one, hopefully it won't in the future, it won't take a pandemic and all the harm and all the trouble it's caused to make us take action. But I think we're seeing we can put health at the forefront. We do value nature. We do value those safe outdoor experiences. And if we can carry that forward with us, also with that health message coming forward from health professionals, I think that could be a way to mobilize people. I think we're seeing it already.
Awesome, thank you. I'll stop there, and I just want to call out a comment from Andre in the chat where he's suggesting doing a campaign where people would ask their family physicians how climate change is affecting their health, which I thought was an interesting idea. And I'll pass it to Shay.
Sure, thank you. Great questions from the group. Thanks all. I wanted to ask you, Melissa, and you were kind of hinting at this, I think. We like to ask our guests kind of like, what's keeping you going? Like what's bringing you hope on a closing note?
I think connecting with the youth movement. Like, I don't know that there's a youth movement in the past that's been so engaged and motivated as youth right now. Like just talking with youth climate organizers like the Sustainabilities, or Like, for example, at my kids' school, like they just sent out an email about what they're doing for Earth Day, and not only recycling and planting trees, but also educating them about what's happening on a larger scale. So I think, yeah, just seeing how, like, this is the next generation, like, and they're beating us, like they're putting us to shame, like in terms of the action that they're taking. So just knowing that there is this generation, there are like generations coming up behind us who are even more engaged on this than we are, I think is what gives me hope.
Yeah, likewise. And what can we do to make sure we're contributing and keeping up, and yeah, so that we can say to our kids and kids' kids that we did all we could. So we've got 5 minutes left, and I was thinking, why not end a little bit early and encourage the group, if you can, if you're able, to take 5 minutes to get outside. If that's not accessible for you, experience nature however that feels. And I just want to say thank you so much, Melissa, for joining us. This was delightful. We really appreciate you taking the time.
Thank you for inviting me, and thanks for everyone who came from wherever you are across Canada or
All
elsewhere.
over. Yeah.
I'm just wishing, I'm wishing you health. I'm wishing you lots of nature time in whatever way you can get it. And I'm just glad that there's interest in this topic, and that we've come together during a pandemic to talk about these important things.
Absolutely. Thank you so much again. Thanks all for joining. Have a lovely day.
Bye.